Hello, everybody. Good afternoon. Thank you for being here. I want to thank everybody for tuning in. Clearly, this is going to take a community response to flatten our curve in Onondaga County and throughout Central New York, and being part of the solution is a big piece of that. I'm here with Commissioner of Emergency Management Dan Weirs and our Health Commissioner Dr. Gupta. They are both doing a great job, and I want to thank you both for all of your work, as well as thank our team in county government who's been working 24/7 for well over 30 days now, related to planning and preparing and then mitigating, and now we're in full frontal combat with the COVID-19 disease. So let's go into some of the numbers. We've had a busy week. We continue to get more numbers in, and our health department is now busier than ever before as we get new cases to go through that process, but also as we begin to release individuals who have recovered and also individuals who are at one point in a quarantine. New numbers. We have now 228 positive cases of COVID-19 in the community. This number is up from 194 yesterday. So there was 34 new positive cases. 23 individuals are in the hospital. 7 individuals are critical. 10 people have been released from the hospital. This is up from yesterday, where we had 3 additional people released from the hospital. Hospitalizations will become a kind of a fluid number. You'll have people who are sick, who have tested positive. At some point, their symptoms get more severe. They'll go into the hospital. You'll have some people going into critical condition coming out of that, people leaving the hospital because they're better. So we have 3 people who are in the hospital that have now gone home, but we've had more people with their fight with COVID-19 also go into the hospital. Some very good news. We're happy to report that today there were 41 people who have recovered and are released from mandatory isolation and quarantine. So the status for today, we have 228 positive cases. You'll see us reporting the positive cases throughout this process because those are people who've tested positive with COVID-19. But we will also be talking about the active cases. So we are presently monitoring 186 active cases in Onondaga County. As you see, we have charts and demographics and data that I know a lot of us are charting. We'll have a positive number, but we'll also start to chart the active cases in Onondaga County. So 186 active cases is actually less than what we had yesterday. Of the hospitalized, every decade is represented except those under 20. This is a further reminder that this virus spares no age group. Some details on our positive cases: 128 are female, 100 are male, 7 are under 19, 19 and under. 48 are in their 20s, 35 in their 30s, 35 in their 40s, 40 in their 50s, 36 in their 60s, 19 in their 70s, 7 in their 80s, and 1 in their 90s. Out of our cases, we have right now 12 contact cases. This number will increase. Contact cases are individuals that went into a quarantine because of contact, family members. We've had an onslaught of new positives as we've gotten our testing data back. Dr. Gupta and her team needs to continue to work on that number. That number will be updated. We anticipate more contact cases out of the numbers, and also at some point when things slow down with new cases, but also as people have recovered, that process starts to slow down. The investigations will continue in how many different cases were associated with each other, not through contact, being quarantine contact. Percentages of breakdowns: 24% are under 30, 39% are under 40, 55% are under 50, 72% are under 60, 28% of our positive cases have been over 60 years old. Breakdown of municipality, City of Syracuse 70, Town of Clay 29, Town of Camillus 17, Town of Cicero 17, Town of Salina 17, Town of DeWitt 15, Town of Onondaga 12, Town of Manlius 11, Town of Pompey 11, Town of Geddes 7, Town of Lysander 7, Town of Skaneateles 4, Town of Van Buren 3, Town of Lafayette 2, Town of Atisco 2, Town of Fabius 1, Town of Marcellus 1, Town of Spafford 1, and Town of Tully 1. Geographically, there's not really much significance here. More populated communities have more cases. That makes sense. The COVID-19 has a true community spread, and in Onondaga County, we have cases in our north, our west, our east, and our south. Testing. We've been a community that has continued to test. We have not been a community that put conservative guidelines on our testing. What we have said from day one is that if you are sick, contact your doctor, and they will go by their guidance to get you tested if they feel necessary. In addition to that, we had the Upstate Triage line, which was there for individuals to call into, get their symptoms looked at and talk to professionals and those who are not insured. They then refer people to the Triage testing site, which has been open for over 2 weeks. So far, we've had 3,215 tests, 228 positives, 2,987 negatives. We received 229 tests back since we spoke yesterday. We still have between Crouse, St. Joe's, Upstate, and the Triage testing site, 375 pending tests. Mind you, out of these 375 pending tests, there are individuals who don't live in our county there, but live in neighboring counties. So that on average has been about anywhere between 15 and 20% of the testing being done was done for people who utilize our hospitals, but may live outside Onondaga County. So those percentages should probably hold true. 7% of those who have been tested have tested positive for COVID-19. That number has gone up recently as more and more of the testing came back over the weekend. We'll see if that number goes down a little bit or not. The negative tests are always reported later than the positives. We get positives very quickly. We'll see what that number holds, if it goes down or holds around 7. Process after a positive test result. Our health department will contact you and check on your health and gather information about direct contacts since the onset of your symptoms. Your primary care provider, your physician, will also contact you as well. This is how we then know how people will go into quarantine because of direct exposure. Direct exposure is not passing an acquaintance in the grocery store or the fact that you share employment with somebody. Those in quarantine due to possible exposure should stay alert to their symptoms and contact their doctor for direction if they become symptomatic. Please answer your calls during this process from our health department and keep your doctor informed if you have any change in your symptoms throughout your quarantine. As a reminder, anyone who tests positive or who has been tested at all for COVID-19, so if you take a test, you are in a quarantine until you get your results. Because we have community spread, everybody should be self-monitoring their health every day, looking for symptoms that we know are there that could be symptomatic of COVID-19 or flu-like symptoms. Dr. Gupta can go over what some of those symptoms look like when she gives her briefing. I can't say this enough. For the most part, everybody is doing this. We do hear examples sometimes when people don't do this. But if you're sick and you're in an essential business, please stay home. This is how we slow this thing down. This is how we flatten our curve. And this is how we get to normal faster. If you're sick, there's no reason for you to go to work, no matter what you have, no matter what virus you have, if you have the stomach bug or whatnot. Stay home. Please stay home. Certainly, your children should be at home. And certainly, I know there's not specific guidance on this, but we got a lot of folks that are nervous. If you're going to the grocery store, it might not be the best idea to bring all your kids with you. That's making people nervous, your neighbors nervous. Keep the kids home if you can. I know that's not always possible, depending on the circumstances, but certainly the grocery store should be used as a necessity to go get groceries, not a kind of day out for the family to get out of the house. We know it's tough, but please think about that. Certainly we're getting a lot of emails and a lot of calls about people who are nervous, whether you're going to the grocery store or going to Lowe's or Home Depot or whatnot, that this isn't a family excursion. If you can keep your kids home, please keep them home. At this time, I'm going to have Dr. Gupta come up and reiterate what it means for to release people from home isolation. We had a lot of new cases today. We're going to continue to have more and more cases each day as people recover. So, Dr. Gupta?
Good afternoon. Thank you. So as we discussed yesterday, in terms of we are continuing to have new cases, and at the same time, people are recovering, which is a good sign. It's a hope. And the criteria which we are using is based on New York State Department of Health guideline, which is based on CDC recommendation. So number one, isolation. Isolation is defined as the people who are put in their own homes or wherever their boundaries are within their apartments, or if they're sharing, that they are not going to be sharing their bedroom or their bathroom if it's possible, or their common spaces. So people are called isolation. These are cases. It means these people are COVID positive. The criteria to release them is much more clear at this point. Is these people have gone through what you want to call incubation period when they were exposed to somebody. It means that 14 days they passed somewhere, and within maybe 5th or 6th, we don't know which day, they develop the symptoms. Their symptoms of fever, cough, shortness of breath, body ache, nausea, vomiting, generalized fatigue, very non-specific symptoms, headache, loss of sense and taste. All these things certainly are clinical findings, and that's how they sought the care of the doctor or got the test. They are going to be released only if they have been fever-free without any use of medication to reduce the fever. It's called antipyretic, like Tylenol or ibuprofen, for 3 days, 72 hours. The second criteria is that they are going to have continued improvement in their symptoms, whether it's a cough, that's a shortness of breath, or anything, feeling fatigued. It means they are going to say, we are continue to feel better. And the third is 7 days have gone since their first onset of symptom. Again, remember, these are the guidelines. They are going to direct us to have a discussion with each and individual case, and then we will make the decision. Depending on somebody has any severe past medical history, significant past medical history of lung disease, heart disease, diabetes, or if they have something else, then we certainly take that into consideration. So based on those criteria, when we review the chart and the staff actually present to us, we will make a consideration that this person is ready to be released from isolation. So the second part is quarantine. So quarantine is for the contacts. Contacts could be household contacts. If parents, if one person is a case, a COVID positive, the rest of the family members are contacts. That's the word we use. And they are going to be in quarantine. They are not isolation. They are not being tested. And we, by association, if they have any symptoms, we can consider they are COVID positive now, even though without the test. However, we use the word contacts for them because they are still in incubation period for the virus. That means their day of exposure, the day they were exposed to their family member, and they have a little bit separation from them in terms of, social isolation within the house and making sure they are not sharing things and all. Then we take those 14 days for them to see if they are developing symptoms. That is very clear. They are not going to get off in 7 days. That is something we want to make sure. So 14 days, because 2 to 14 days is the maximum day of incubation period for this virus to come out and show if the symptoms. The similar thing is applicable to the outside household contact, that they are going to be, depending on the day they were exposed to the case, and we will monitor their symptoms, or they will monitor their symptoms for 14 days. If no symptoms, no fever, no nothing, then they can be released from quarantine. However, if anyone have any symptoms in between, that they got 4th or 5th day of their quarantine, they start to have cough, they start to have shortness of breath, headache, or any symptoms which are suggestive of COVID-19, we are going to presume that they are sort of a COVID positive case. Whether they get the testing or no, it's irrelevant at this point, because they are going to continue to be monitored now, and then we will give them guidance to be released, not at 14 days, depending on when the symptoms came. If they came at the 7th day or 8th day, then we will have to monitor them. So 14 day is a guidance for the quarantine, and for COVID positive cases, 7 days without fever is also a guidance. And that's a case-by-case basis we have to take into consideration. This is very crucial. And one other thing is very important. Even though when people are released after they have been, whether it's isolation and quarantine, we have community transmission. We don't know if you can get reinfected. That is a very crucial part of that. So the principles of social distancing, making sure you don't have big congregation, making sure you're following all the recommendation which is given by either by governor, whether president or county executive, you are going to follow those recommendations to the nth end until proved otherwise. So my biggest request to both the community members, to the entire community, including physician community, that please continue to practice those principles. That's how we can actually reduce the transmission of virus. Thank you.
Thank you, Doctor. Related to social distancing, I think we're doing very well. I think we're getting better. As a community, we're getting used to this. This is difficult, this is hard, so I want to thank everybody for doing their part. Certainly, as the positive numbers keep going up, it's going to be easier in the near term for social distancing, but we also need to remember right now, hopefully we're getting into a period where we're going to continue to get new cases, but people are going to recover. And at some point, you might have more people recovering than new cases each day. We need to be vigilant, and we really need to starve this virus right now so that we can get back to our way of life that we are so used to. Certainly, yesterday we saw that the president extended the social distancing guidelines at least through April. So we're certainly going to be assessing what that means. We'll continue to look for gaps in our local community of different things that we may or may not be able to do to kind of continue this effort to social distance. Today is the first day we have fewer active cases than yesterday. So technically, even though we have more positive cases, we've had a lot of recoveries. So that's good, but we need to continue on that path. How do we do it? We continue to test. We continue to make sure when people are sick, they call their doctor so that their doctor can give them guidance on testing. And then we continue to identify people who are sick, we continue to quarantine, and then we continue to social distance. That's how we flatten this, that's how we bend it. A couple important hotlines that are critical for people that need help. Again, the Upstate Triage Hotline, which is certainly a number that you call if you don't have a doctor or you're experiencing some symptoms. Your doctor may refer you there if they are very busy, but that phone number is 315-464-3979. Our seniors, our healthcare workers, and adult nutrition hotlines, 315-218-1987. Again, if there's any gap in needs, whether it's a meal, whether you haven't been able to get to the grocery store, you need help, we have an amazing set of county employees and volunteers who are helping these individuals. Childcare has been, we've had a plan for a while. We still have a plan. We're going to continue our program through April now. for our emergency responders, our healthcare workers, and our essential businesses through Childcare Solutions, 315-446-1220. Donations of PPE, emergency medical supplies for our hospitals, our doctors' offices, our emergency responders. We're seeing each day this is a struggle. Everyone in the country, in the United States, plus other countries, are all trying to get this equipment for their communities. If you have this equipment, you're a business and you have this equipment, whether they're masks or anything else, and you can donate some, it's very much appreciated. Please call us at 315-435-2525. Again, volunteers are going to be needed and necessary throughout this process. If you have the ability to volunteer, certainly call this number, Volunteer CNY, 315-428-2229. Whatever your capacity is, people will try to find something for you to do. And we've had a lot of people who are so gracious with trying to volunteer their time, and these are people that really need to be staying home for the Matilda's Law, but I think that just talks about the spirit that we have here in Onondaga County. And certainly, mental health continues to be an ongoing issue, and we recognize that. And that's why we have resources for people. If they need to talk to somebody, please call 211. We have mental health professionals there that can help you get through the day, help work on strategies with your children and whatnot. Again, there's a lot of other thank yous for our frontline workers in county government, our folks on the front lines at our essential businesses, our volunteers. This has been a community response, and our community is doing well. We need to continue to do well as we move on in this process. Questions?
When people are released from isolation, is that the same number of people that you're reporting as recovered?
That out of the 41 today, Tim, that is, yes.
Okay. And
So
is
those
that
are
number,
those.
or is that since yesterday?
That's over the last 24 hours.
So there were 5 reported yesterday. That would be additional.
Correct.
And are people self-monitoring?
Oh, it's total. 41's total. So so you had 5 yesterday, so 36 today. Or less. Yep.
Do people self-monitor their temperature and symptoms, or does someone visit?
So they can self-monitor. We are asking people to self-monitor because we do call. But when you have more increasing number of cases, when you have hundreds of them, there is no way we can reach out to everybody. That is true. So we prioritize who are the high-risk patients, which we really need to contact them, especially they're elderly, they are by themselves, so they become our higher priority that we are checking on them. And that's one of the reasons we ask primary care doctors also to stay involved. They have 2 people now to be involved in their at least care in a way that we are not physically there, but either their primary care doctor to do with the telemedicine, if they have that facility available to them, and our nurses also do calls. And they do also call us also. The patients are calling us also. Once they connect with somebody, I think it's important. We are prioritizing who are high-risk individuals. And they do monitor because the releasing criteria are very specific in terms of that we need 3 days of no temperature there. Like it shouldn't have fever, essentially. That's what I mean.
I have a question for Dr. Gupta. Hi. I think that you had mentioned that when a family member is, test positive for COVID, you guys aren't necessarily testing the other members of the family, and I'm just curious as to why not, because if you did, that would probably paint like a more accurate picture of how easily this spreads and how many people are actually infected, right?
Right. So it's a good question. If we have so much testing available that we can test everybody, that will be great, but we don't have it. Maybe with the nuance of tested, we might have the self-testing and all, people might be able to test. But at this time, we really need to make sure we have enough testing, which we do have fairly good number of testing here, that for those who we need to identify. So if you have a case which is confirmed in a household, and by association, if they are started to develop symptoms on day 3 or 4 or 5, unless proved otherwise, they have COVID-19. And they are not going to be released from the quarantine until at least 14 days or maybe more, because depending on when their symptoms appeared. So a lot of those things, the clinical management does not change because there's no medication at this point that we can use it. If people continue to, let's say if you have a family member who is a contact of a case, of a COVID positive case in the family, and they started to show signs and symptoms having much worsening of fever or something, then we will ask them to go to be seen and get tested at that time. So we do case by case basis. Not everybody needs to be tested. And this way, people who are going to be hospitalized, we are trying to identify them ahead of time and making sure they can get supportive care. Maybe they're getting more short of breaths. Maybe they need oxygen. Maybe they're getting dehydrated, so they need intravenous fluids. They're not eating, so they need nutrition. So a lot of those things are pretty much based on what the conversation is.
And just to reiterate that point, when you look at some of these communities in downstate New York, we've been saying for weeks that if you're in this community and you have a wide community spread and you come down with symptoms, you just treat them for COVID-19. Why test, especially if testing is an issue? And for us, the testing becomes of real value because you identify new cases. Okay, that's the value. You identify new cases, new case, quarantine. Within that quarantine, you almost anticipate that some of those people will be sick if they've had direct contact. So when you look at the ability to do widespread testing, you really don't want to, and we have done some testing on family members, right? That has happened. But once you get to a point where you have one household, mom or dad gets it, and then there's two other, brother, sister lives there too. They all get the same symptoms. Just treat them, right? Treat them. Use the test, the robust testing you have there. I think at some point, and we've talked about this, the market in testing is getting interesting, right? And we're getting inundated with potential products that are making very interesting promises. Hourly turn times, 15 minutes, yes, turn times type things. If that actually happens and these tests are a reasonable price, certainly we would love to be able to say, anybody who's in the workforce, come and you all get tested in 1 or 2 days, then you can identify all the positives, you can start the quarantines, and then you can essentially say to everybody else, you can go back to work now. If you had that capability with robust numbers and a right there and then turnaround time, you can really do some interesting things. But certainly, we've been able to test more aggressively, but at some point, if you have siblings that one's sick, the other one gets sick with the exact same symptoms, you know what it is. You just got to treat it.
Ryan, you had a big spike in numbers as a county yesterday,
Yeah.
A relative spike today. Can you still attribute that to the surge in testing about a week ago and those results still coming in, or are we still seeing some pretty big numbers of sick people?
Yeah, I think we had those backlogs get through, and you had a little bit more of that this morning get through. So I think there's a little bit there. We were looking at 5.9% type range before. Now we jumped to 7. So it'd be interesting. You can make some other assumptions too. Maybe in the beginning, one of our challenges why we came out with the triage testing site was because the hospitals were so concerned about the ER backup because of respiratory illness. Remember, the respiratory illness was flat, and it should have been going down. So maybe that that curve, maybe it's starting to go down a little bit too. So there's just not as many people with these symptoms, and then the people that have the symptoms, a higher rate of them are now COVID positive. So there's a lot that we probably don't know about right now, but you can make some assumptions into it. Yeah, doctor?
Yes, so one thing which we are seeing in the recent ones, last few days, is that people who had symptoms maybe a week or 10 days ago, and they just wanted to get it tested. By the time they got tested, they were a lot better. So there's more awareness, and people are feeling comfortable their testing available. So that is also seeing that more people got tested.
So even though they're waiting to get tested, they're still coming back positive,
Yeah.
but they're already
They're
beyond.
already better, actually. They feel like, you are already better. Why did you go for testing, right? So just wanted to.
So some of this is just promotion that testing is available because you're on television every day. Some people are showing up now that may have not shown up 2 weeks ago.
We hope so. We hope anybody, the goal is, as long as we have supplies and testing we do, that anybody who is sick calls their doctor, and so that we can stay ahead of this and identify those cases that are there, get those people help, and start the quarantines. And you're talking 2-3 week quarantine timetables, right? So that's the goal here. We've seen the demand flatten out. It was here. There's no doubt. We've now had a week of demand flatten out across all of our the various hospitals and the triage testing sites. So there's some explanation to that. We'll probably know later on. I have my theories, and sometimes I'm right, sometimes I'm wrong.
41 people recovered divided by 228 total cases. That's about 18. That is 18%. I used my calculator. I had to cheat. But that's 18%. That's a large chunk of people of the total already moving on with their lives.
Yeah, which is great. And so we think hopefully we'll see higher recovery rates in our community because of the type of medical resources we have. And so we're going to knock on wood on that. But we're happy. It's tough. Look I think I break out in hives every time I get a bunch of positives when I hear that. But then Dr. Gupta gave me some of this news today and then told me about all the recoveries, so that softened the blow. But this is part of the process. You need to identify who's sick. We know it's here. If you look at your counties across upstate New York, the counties that have airports that are used a lot have more cases. Erie County, Monroe County, Onondaga County. So where you have airports, we have people flying back and forth every day. We still have people flying back and forth. There's still flights to New York City every day, and to other areas that have had outbreaks and community spread as well. So we knew we're very connected. We're a larger county. We knew we would get cases. We got to identify them. We got to quarantine them. And if people social distance, this thing's going to start to starve itself a little bit.
Can you explain what it means to have fewer active cases, and is that statistically significant?
I think we're on the first kind of day of that, so I think it will become statistically significant if we see that kind of creates like its own curve a little bit. We'll still have we're still tracking positives, right? There'll always be positive cases. That number will always be what it is. But certainly when you look at the pressure on the medical infrastructure in the community and the risk is the individuals who are sick and who are symptomatic that can spread. So that number going down it's a big deal, and hopefully this is part of a trend and not a one-day anomaly.
When a person who's in isolation, and Dr. Gupta, you might be able to answer this, but when a person in isolation is released from isolation, are they then considered recovered? And then kind of going back to the testing, if you're not necessarily going to be testing everyone, are you guys still confident that when the curve flattens, those numbers are accurate?
So let me just reiterate your question. Mm-hmm. You are looking for that they are being released and they are recovered.
Yes,
released
exactly.
is equal to recovered. Yes, the answer to that question. So when we say, when you see in the map, you see the number of people recovered. They are released now. They are released from isolation. We are not putting people in the quarantine there in that area. So quarantine are multiple contacts, household contacts which are not tested. Those in the maps which you're seeing are the people, the cases who have been now not considered they are recovered. So they are going into that direction and they are not active cases anymore. So total number of cases and then active cases. Active cases means we continue to monitor them, right? Does that answer your question?
Yes.
And are they considered contagious? We do not believe so, but there's so much is not known about this virus. That's why we continue to advocate and ask for people. It's not a free ride for you to have, group of 5 people congregating and partying and all these things which actually are against the principles of public health and social distancing. We don't want them to do that. We want them to be really steward of the public health and advocate of the public health to make sure they are the leaders to promote the prevention of the transmission of virus in this our community.
Thank you.
Ryan, St. Joseph's Hospital reported that they're critically short of personal protective equipment. Have you heard from other hospitals that they're facing the same thing?
Yeah, it's an ongoing challenge. I think hospitals, so we're always working on our own supply chain. We've actually made substantial purchases of PPE. We're waiting for them to be delivered, hopefully by Friday. When we get this, certainly we're giving these 2 hospitals, nursing homes, as well as first responders. But it's an ongoing challenge. We'll work with St. Joe's and all our other hospitals to make sure they don't run out in the meantime. But every hospital trying to do their own supply chain. Certainly we are. When you have the hospitals and the counties and the governments doing it, it's very hard for a nursing home or a practice to get the proper gear. So we're basically buying it and giving it away to everybody in the community that needs it. We had a small doctor's office this morning that was going to run out today that we are going to get some masks too. So this is an ongoing daily thing that our emergency operations center deals with. But certainly we'll make sure St. Joe's isn't going to run out. And then we have a large order hopefully in on Friday.
A nursing home reported to us that it's reusing masks over and over. And is reuse of a mask basically just the reality right now, and is that okay? Or can the county step in and give it to more places once this order comes through?
Yeah, I mean, I think, how big was that order we just did? Yeah, I mean, we just made $1 million order for supplies, okay? All PPE. And so that's something that we didn't budget for, right? Right now we're in a healthcare emergency. At some point, when we flatten this curve, we're going to be in a economic fiscal emergency. So we did this. We know that those gaps are there. We know it's very hard for these smaller entities to get it, Andrew. Whether or not it's safe, I'm going to make an assumption it's probably okay. You probably want new ones, but certainly there's many of these entities that reach out to us and we're getting them everything we have on a basis. And mind you, a lot of the federal assistance that's come into the state hasn't made its way up here. Most of that is going down into the crises, whether it's in New York City or the 5 or 6 other suburban counties around New York City that certainly have a much wider community spread.
$1 million breaks into what roughly? How many of each? Just for general.
Hundreds of thousands,
Yeah,
right?
it's across the board depending on what kind of supply it is. So
Come
it's a combination of gloves and eye protection, surgical masks, N95 masks, disposable gowns, Tyvek suits if we can't get disposable gowns. So we're really trying to get a good baseline of all of the different basic types of PPE that we can distribute out to the community that needs them.
Safe to say thousands of each, though.
Oh yeah, yes.
Yeah.
I mean, hundreds of thousands in some cases.
Yeah. So we're trying to, everybody's competing. There's a marketplace. The marketplace is getting a little bit better. New people are trying to get into it. But this is a problem in some communities now. This problem is going to spread to the rest of the country. To what degree? Hopefully they're learning the lessons that we have learned and the practices we've adopted where we've had success. So this is a challenge, and it will continue to be a challenge.
It's been 2 weeks since the first case here. What's the biggest challenge for you over that time?
For county government or?
Yeah, like you've faced in the last 2 weeks.
Yeah. Look at our health department every day. They get a positive. They have to go into an investigative mode. And when you're talking about the last week where we've had so many positives, so many new quarantines, and now we're getting people off of quarantine, the recoveries. So that's a challenge. And it's all a challenge right now, Trish. I mean, it's one that our team has been up for, and I think everybody's doing very, very well. But this is unprecedented. And to give everybody in the community an idea about how unprecedented this is, and that's why we need people to really buy into what we're saying. Our emergency operations center is in day 15. That's the longest it's ever been open for. I think the Labor Day storm was 14 days in '98. This is serious stuff, whether it's people running out of equipment during the day and you're running around and you're scrambling, whether it's you're identifying people who are sick people who need to go for higher levels of care and need to go to the hospital. This is all life and death for many, many people. And we have great professionals, and we're getting through this better than a lot of communities. But the challenge is there. The challenge is going to continue to be here. But this is a big week. We got caught up on testing over the weekend. So we're getting faster data so that the health department can do their job, identify new cases, quarantine, and then that we're starting to get some of the recoveries in here. So in an ideal world, the curve starts to flatten for positives, starts to get better like this. And then with recoveries, our active cases start to go like this. There's a lot that can go wrong, and that's if the community doesn't respond well to social distancing. Because if those things start to happen and we really dive in next 2 to 3 weeks, we really starve this thing, I think we're going to be in good shape.
Ryan, can you believe it's been 2 weeks since
No.
COVID-19 was in this county?
No, I mean, because we've been preparing for it for weeks before then. So I think for our teams in health, emergency management, our office, I think it's been over a month of just basically 24/7 on COVID-19. And we're in full-blown combat, right? But we're also planning on what's the next process look like from a health standpoint. We have to start talking about economic realities of this situation for us as a government, knowing that many of the decisions that were made to keep people home from work, to not allow events to happen, at the same time, that's our revenue that evaporated, right? Just like the state. You heard the governor talk about it. We're the exact same thing. Counties are miniature states. We do the exact same things. And so our revenue has evaporated for this time period, and that is going to be a real problem in the weeks ahead.
I have a question about the future of school closures, just in light of the president kind of announcing extending distancing till the 30th, but right now, from my understanding, schools are only closed till the 15th. So what's kind of the future with that? Is it just a day-by-day approach?
Yeah, I think we got to just take it. I know we got to the 15th now. I mean, the reality is it's probably going to go a little bit longer than that. But the federal government's giving guidance, right? They haven't put anything into real laws. They give guidance. We think it's smart guidance. And then the state does some different things. Then we look at different things and see if there's any gaps so that we can, really flatten this thing out. But overall, I think the reality is we knew last week they're going to have to extend this to kind of the date where we were the whole time. But now I would be surprised if it doesn't get extended again, whether it's the end of April or another week, and then you play it by ear. But certainly, if our data continues to come back the way it is and we start to see a little bit of hope, a little bit of light here, we're going to need 2 to 3 real good weeks of social distancing to really get this thing going in the right direction.
Ryan, we were made aware of a Facebook post. A hairdresser is offering basically to go rogue and do people's hair. Even if it happens in the privacy of a home, using proper protections, is it okay, or is it just something that people need to avoid entirely right now?
Yeah, look, it's not, I mean, it's not okay. We're not going to be able to police somebody showing up at someone's house and giving them a haircut, but we had a call about a shop that people thought was open in the town of Clay. We sent somebody out there. They weren't open. They just had their lights on still. So we still get these calls, but this is tough. And there's real mental health anxiety going on right now. The economic reality for families is setting in right now. People are trying to file unemployment, even though unemployment benefits are pretty robust with the new stimulus package. It's hard for them to get the unemployment signed up for because of the phone line being busy and the state website being as busy. You know, business owners are looking at the bottom line and they're trying to figure out how they're going to salvage a year. This is tough, and it's going to get a different type of tough. It's going to, as we make progress on the public health side, the economic reality of what just happened to us is going to really set in. And we just need to be transparent about it. We need to talk about it, figure out as a community how we can get around it. And then we got to move on, and we got to try to get this economy going again. But I get the person who owns that business wanting to get back at it because they're probably looking at their financial situation and it's deteriorating. But how that deterioration expands and goes longer than necessary is if people all start doing that and everybody starts another wave of community spread.
And I know you don't oversee Upstate Hospital as much as everyone thinks you oversee every single aspect of the health system, private and public. I know you don't oversee it, and I'm sure HIPAA laws apply to what you are aware of, but any idea if there's patients from other parts of this state being treated for COVID-19?
So I got this question earlier, and we talk to our hospitals every day, and we've talked to the state. So from the standpoint, is there anybody in our hospitals from another county? Yes. Are they from upstate or northern New York counties? Most likely. Has there been any patients that have been brought up from New York City or the downstate suburbs to our hospitals related to COVID-19? Not at this point. So we've had conversations with all of the above. The appropriate way for that to happen is for New York State and Onondaga County to have a conversation and to talk about what our emergency plan can handle, what the current capacity is, and making sure we still have enough beds for our central New York counties and our northern New York counties. And if there's surplus, we're going to help our neighbors out from other counties, because if the roles were reversed, we would want our sick people to go to their open hospital beds. Okay, let's not forget this. We're all a state, and if upstate New York was going through the hard end of the pandemic first, and we needed to save our family members' lives, we would want that to happen. So we're not saying no to any of that. We just need to do it all within the plan that we put forward and that we've been working on for over a month, because the plan has actually worked pretty well for our community to date.
Is there any more specific on the use of Manley Fieldhouse in that regard? Would that be a site for?
Yeah, I think, Tim, we're depending on what type of patient was being moved or utilized to free up different spaces, I think determines what you have. Manley, obviously, we're looking at as a surge site for ICU patients. We're not even close to that, but I think that's part of a discussion, and certainly with any patients from outside the area, certainly there would be an anticipation of materials and supplies to come with that.
Are you still trying to acquire ventilators?
I believe we've acquired about 70 ventilators. Right now, we're pretty comfortable where we are with ventilators. We continue to have feelers out there in the event that a opportunity presents themselves. I know the state has been very active in acquiring ventilators that have become open, and I know now the Defense Production Act has been implemented, where you're seeing companies like GM, I think Branson's company, and you look at Tesla, all these different companies are getting into this space in the short term. So hopefully that is going to get produced, and our friends downstate are going to see more ventilators. We saw what the Javits Center looked like today. Certainly a pretty amazing turnaround time for a very large convention center to be turned into a hospital the way it has been.
Is the county going to be pushing back the deadline to pay county property taxes?
No. The taxes are due when they're due. The city does collection for us in the city, so their policies will be there. But certainly when it comes to property taxes, if people don't pay their property taxes, then we don't have any money. And then when you want us to go call the sheriff to go do this or that, there is no sheriff, right? When you need people right now who've been working 24/7, How do we pay for it? 12% property taxes, 52% sales tax, the rest of it some sort of state and federal aid. And our sales tax is absolutely getting clobbered right now because we've had to shut down the economy. So we need to continue to have people pay their bills, and certainly, I think each locality will have to assess, depending on what happens with payments and late fees and things like that. Is there different ways to work with people on those types of issues? Maybe, but people still need to pay their taxes.
Do you have an updated number on 911 calls about social distancing?
I don't have an updated number.
Any read on if it's improving with your regular messages, just as bad?
The only assessment I would have is the type of communications our office gets. We're still getting a lot of communications. But that's something that we can work on maybe for a 911 call update.
Do you want to drive the streets yourself to look with maybe a loudspeaker?
No, I think on my daily routes around what I do, things have gotten better. People are doing a good job. You aren't seeing as much people just congregating. People took advantage of the nice weather, taking nice walks, doing it in a proper way. So it was good. Tim?
You don't know the first quarter sales tax numbers, do you, to know?
No, so how the sales tax numbers work is we're always about 4 or 5 weeks delayed. And so we were seeing some growth in the beginning part of the year. Here's a sobering number, and this is one that we should all pay attention to. Unemployment data came out for February in New York State. And just think about where we were. And this is where we're going to have to get back to as a community. It was at 3.7%. In the end of March, that number is, people aren't even going to think that 3.7% was real because of what has happened. So we'll know this week's activity and last week's activity probably 4 or 5 weeks from now. And how that will hit us is we will basically, you're expecting $30 million worth of revenue coming in. We might get 3. So you're going to have a real cash crunch. And you may work yourself out of that hole, or that may be a sustained problem, and you might work yourself out of that hole, but you will have an immediate emergency. And so that's going to be a real challenge that we're going to face, and we're going to know, and we're going to communicate about it, and we're already planning for it.
Is social services seeing a surge in applications
Yeah.
for assistance to Medicaid? And
I know our food stamp numbers were up over 30%. On Medicaid, that's one we can probably look at. That usually flows through the state, but we can try to get those numbers too. But my guess is you're going to see increases in temporary assistance, food stamps. You're going to see increases in Medicaid because you now have people who are unemployed and need health insurance.
food stamps is up to 30%?
30% since March 16th.
Since March 16th.
Mm-hmm. Anything else?
You still have enough test kits to carry on with robust?
Yeah, we do. Into the testing point, we're still testing. We're testing people who are symptomatic. Again, if you're talking about family members inside a house and they have symptoms, you can make a very educated assumption that you probably don't need to utilize a test kit on that person. They got it. Yeah.
You did a great job with good news over the weekend.
Yes.
I'm back, though. What's the good news?
All right, Andrew. Really one of the shining stars of consumer products over the last month, one that was so underappreciated, the good old-fashioned toilet paper roll, is certainly been in high demand. It's certainly been a product of anxiety for the public when they don't get enough toilet paper. We are pleased that through a partnership with our friends at Syracuse University, Lemoyne, and OCC, they have donated to us pallets of toilet paper. And this toilet paper is now being used to distribute to many of the folks on our seniors, healthcare workers, and adults who are now find themselves at home. So we want to thank our partners at SU, Lemoyne, and OCC, and we always want to thank our friends who make toilet paper.
Is the county seal embroidered on the paper?
No. Thanks, Andrew.